Hi, I'm Dr. Francis Hayden, and this is a Mental Health Minute. Today is Thursday, the 6th of August, 2015, and I'd like to tell you about a very important piece of legislation that's waiting for Governor Cuomo's signature called Prescriber Prevails, and urge you to contact the governor to ask him to sign this crucial legislation for the benefit of patient care. I'd like to read you from a letter that I sent to Governor Cuomo. Dear Governor Cuomo, I am a practicing psychiatrist in New York State. I'm writing to urge you to sign A7208 S4893 into law. This legislation will reform Prescriber Prevails in Medicaid managed care, a critically important patient protection, to ensure that psychiatrists such as myself and other physicians and healthcare professionals can prescribe the medications that they believe are most appropriate and efficacious for their patient's condition. This is especially important at a time when you and your administration are implementing efforts to reduce avoidable hospitalizations, a strong component of which is ensuring that the patient receives the medication that they need. Under current law, psychiatrists such as myself are spending nearly a fifth of their time battling with managed care companies trying to get approval for the medications that their patients need in order to remain healthy and out of the hospital. Among other things, the bill would remove the requirement that a prescriber, quote, demonstrate that a medication is medically necessary and warranted, a process that the managed care companies have used to demand endless evidence and documentation that varies among more than 24 managed care companies who each have their own formularies. Continuity in prescribing psychiatric medication is especially important as different patients with the same diagnosis respond differently to the same medication. There is no one-size-fits-all in psychiatric practice. Furthermore, it takes time to find the most effective medication and dose for any given patient. Prior authorization, as currently practiced in the managed care industry, results in countless instances of painstakingly formulated medication regimens for fragile patients being discontinued pending a lengthy appeals process. Failed first policies, opaque approval processes that do not even permit the doctor to speak to an actual pharmacist, and companies whose PA processes only allow filling out a form without the ability to speak to a live person. We also have to deal with at times with illiterate or incompetent or callous customer service representatives and a host of other issues, resulting in cruel experimentation and interruption of care for patients who are either already stabilized or in need of rapid stabilization. And numerous emergency room visits and hospitalization, not to mention suicide attempts, have occurred. This practice is unethical, immoral, fiscally inane, and unwise, and ought to be illegal. As such, I urge you to sign A7208 S4893 into law. Very truly yours, Francis Hayden, MD. And I'd like to urge each one of you as well to contact the governor and urge him to sign this important legislation for the benefit of patients' health. This is Dr. Francis Hayden, and this has been a Mental Health Minute.